Hi everybody, I'm Martha Kennedy. I'm not the know-it-all wound doll expert, but I do want to go over with you one in particular wound that we're doing here and some new things we're doing. As we do this video, it's going to be short, so instead of washing my hands, changing my gloves, I'll just tell you when that should be done. Now, we're doing it on what we're going to say is a wound right here. So we're going to say that this is a stage 3 wound. Okay? So my orders are like this. It says remove the dressing. So when I go in, the first thing I want to do, I want to see if the resident's dirty. If they're dirty, I'm going to clean them up. This one, because it happens to be on the sacral area. Clean them up, throw that away, wash my hands, put on gloves, and then I'm going to take off the old bandage, put it down, go wash my hands, and now I'm ready to start my treatment. This treatment in particular says that I'm going to rinse with normal saline. So I like these little saline bullets. The reason I like them is because when you squeeze it, it gives it a little pressure. So my orders are rinse, cleanse with normal saline, pat dry, and then we're going to apply what's called VASH. And I'll teach y'all how to do that. And then after that, we'll pat dry. We're going to put some calomaseptine around the area, Aquacil in the middle. Then we're going to put Shore Prep. After that dries, we're going to put the bandage on it. Underneath the bandage. Okay. So here's the wound, I'm cleaning it. Usually you have the patient on the side, so it'll rinse down and just kind of get it a good cleaning. So I've got that done. I still have my gloves. I pat dry. Pat, right? I said pat. Now I'm not gonna go because we just want to pat dry. Okay, then always have your trash ready to go. Now, we talked about after I rinse with normal saline, I was gonna use VASH. So as you can see right here, it's the name VASH. And with this, what you're gonna do is you're going to put this on some 4x4s, and you wanna get it to where it's pretty soaked, not totally. Now remember, I have gloves on during this. Now, I set a couple of them in here. So the first one I can take, if this patient has a wound that has a little bit of an area that's deep, I can put this down into it. And I put it like that, kind of make sure it gets over it. And then with the other, I'll lay it over it. Now this needs to stay on for 5 minutes. And this is amazing what it can do. It's an antimicrobial. So after 5 minutes, we'll say, blah, 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 blah. Okay, 5 minutes has passed. I'm gonna come here, I'm gonna take this off, put it in the trash, right? And then I'm gonna get my calomaseptine, and we're gonna say that I have a tongue depressor. Do I have one? Okay, I should have already had this ready to go, sorry about that. So usually you'll put it in a cup, so I have this. So when it says to put it around the peri wound, everybody knows the peri wound is around here, right? Also notice I do have this. So my peri wound is right here. Of course you don't do that, but this is what it should look like, okay? You have it like that. Now what did I say I was going to do after my peri wound? I'm going to put, no, I want the adhesive dressing. I'm going to put, let's see, I'm pretending like this is my calcium, right? So we know it's not, but I would just put the calcium in there after that's done. Then I'm going to take this, no sting skin barrier. The key to this is that you need to let it dry, okay? So this is just going to go around this area, right here. You can use one or two, but it's important to let it dry for a minute. If you put it on when it's wet, it won't stick. A lot of these areas, like the coccyx or abdominal folds or buttocks, they're kind of hard to keep them on. But if you use this, you're going to find that it really sticks well. When I put this bandage on, I want you to think about the bandage being kind of like a Duoderm. So the bandage is kind of like this, right? When I warm it up, it opens some, and it can kind of grab the skin underneath it, and it closes up as it cools, so it really attaches. So when I put this bandage on, of course I have my date and time on there. I make sure this is dry. I'm gonna try to put it, and right here, this is the opening for the anus, so I wanna go up here a little bit further, right? Go about right there. And as I'm putting it on, I wanna go over the edges. Remember we talked about warming? So if I warm that up some, not hurting the wound, but just going around the edges, that will really stay on. You'll find when it's somewhere where they're having pericure or those hard to reach places, this is really gonna help you make sure it stays on. Of course, after you clean it, after you take off the dirty, you wash your hands. After you clean it, you wash your hands. And before you apply the dressing, you wash your hands. And then when you're complete, of course, you grab all your supplies and wash your hands. Thank you for watching. Bye.